when it comes to our health, we all hope we never have to fight cancer. But the reality is cancer is much easier to treat the earlier it's detected. And that's why Overlake Medical Center has their high-risk cancer surveillance program. And we, of course, want you to know about it. Here with more on that is Overlake Medical Center nurse practitioner Patricia Mathis, gynecologic surgical oncologist Dr. Emily Wu, and cancer previvor Marian Von Fuchs. Thank you so much, you all, and welcome to being here.
Thank you.
And Patricia, we want to start with you. What is this high-risk cancer surveillance program, and what's it all about?
So our goal is to help patients detect if they have a risk for cancer and then develop an individualized program for them.
Amazing. And what services are specifically offered to at the clinic?
So we offer risk assessment, genetic counseling, nutrition services, social support, and then of course our surgeons and our oncologists.
Wow. Okay. And Dr. Wu, I want to get over to you. Through genetic testing and surveillance, typically, what are the next steps in this process?
It really depends on the individual and the situation, and so a lot of them we learn about after they've undergone genetic testing, and often that comes about because of seeing that someone has a strong family history of cancer, and that leads us to better want to understand their risk of cancer. And so I'll speak specifically, such as in Marian's case, where someone is identified to have inherited a mutation that predisposes them to cancer. And the first thing we'll do is we'll sit and talk to them about what we feel like is their cancer risk. We'll talk about what options there may be for more surveillance to try to detect cancer early or to prevent it, and also specific strategies that we can design individualized to the person in front of us that can actually reduce or even reduce the risk of or prevent cancer.
Yeah, and Marian, I want to get over to you as a patient who has received care at Overlake Cancer Center. Just describe your experience to me and being a part, you know, and working with the care team.
Right, so I was referred originally because my mom had ovarian cancer at a young age, which is a red flag. So I underwent the genetic testing, and even though I knew it was a possibility, it was still a surprise to me when it came back positive. So a little bit overwhelming, it's complicated, so I was happy to have Patricia on the team, and she really helped organize for me like what my priorities should be, what all the different risks meant, and really just develop a plan. And the priority turned out to be a hysterectomy, which Dr. Wu then performed.
Wow, and talk to me too, you know, it's comprehensive, but having that bedside manner too, I imagine is so important. So talk to me about your experience with both of these lovely women.
Well, they are both highly trained and professional at what they do, and they really knocked it out of the park in terms of excelling in their individual areas of expertise, and I can't imagine having gone through it without either of them as part of the team.
Wow, so incredible. And do you want to speak to the importance of screening for people that might be watching too?
Yes, I am a firm believer in screening because I think the earlier you catch something, the earlier you can treat it, and the higher your chances are of preventing it or curing it or working with it.
Definitely. Thank you so much for sharing your story with that. And Patricia, I want to get back to you. Why would people want to choose, you know, this high-risk cancer surveillance in your cancer prevention journey if they're debating where to go?
So we really have a great team, and we really do individualized care. We also really want to help families, and so we identify people who might be at risk beyond just the patient who's in front of us.
Definitely. And Dr. Wu, anything else that you want people to know about with screening and just the importance of what you all do on a day-to-day basis?
So I agree with my colleagues that screening is very important, and I think it's just important to have a conversation with your physician or your provider about what screening may be needed or helpful for you.
Definitely. And just the supportive environment too for someone that hasn't visited y'all. What would you want people to know about that too, and how that goes hand in hand?
That we take a very multidisciplinary approach, and we see each patient as an individual, so we really tailor our recommendations and even the way we communicate to that particular individual and what their needs may be.
Amazing. Marian, how are you doing today too? Feeling good?
Yeah, I feel great. It's been about 9 months since this whole journey started, and I feel good, and I feel equipped and educated, and I think that's really important.
Definitely. Education is power for sure. Thank you all to you both for being here and sharing all this important information. We really appreciate it.
Thanks for having us.
Thank you.
And to learn more about what we discussed today, please visit the website that you see right there on your screen. And we're also, of course, going to have more on New Day's website.
This portion of New Day Northwest is sponsored by Overlake Medical Center,